Hi, this is Kirk, the bariatric carnivore. Should your 12-year-old son be playing tackle football? And you may be saying that it may be the dumbest question I would have ever expected to hear on a channel devoted to health, bariatric surgery, and carnivore way of eating. But frankly, it points out once again the psychopathic nature of our medical system and how they're sticking their noses into things that are really, frankly, none of their business as a doctor. They're not getting you healthy, they're getting involved in other stuff. And the reason I bring this up is because in the current issue of the New England Journal of Medicine, there is a big, long pro-con debate over whether a doctor who has been asked to give a sports physical should counsel a parent on whether a kid should play tackle football at 12 years of age. And the correct answer to it should have been, none of your freaking business. It's a parental decision. Because there's no medical evidence. I mean, you can get yourself injured driving over to the doctor's office. So, I mean, the risk of injury is always there for almost any activity. Getting out of bed can cause injury. Falling down on the ground can give you a concussion just as easily as you could on the football field. And frankly, there's really no good evidence that even players that have been in the NFL for 20 years and have had multiple concussions are really permanently brain damaged. That is a lot of speculation, but there's no real hardcore double-blind studies that have tracked this stuff over the long time. So we don't know what the long-term effects are. And frankly, you can't give medical advice based on your opinion, or at least you shouldn't. But unfortunately, in today's society, with zealots in too many of these major medical organizations, people are giving opinions based on their feelings rather than medical evidence. And this is kind of the problem. Then you see this, that there are people that, there are doctors that are giving nutritional advice not based on science, but frankly, based on their feelings, based on their own experience, but that's not medical information. And frankly, they need to have enough guts to say, we don't know. It's not a medical decision, and we're going to stay the heck out of it. But they won't do it. I noticed this during COVID. American Academy of Pediatricians was completely in favor of getting the public schools open as quickly as possible until Donald Trump came out and said that he wanted the schools open right away. In which case they were opposed to it. Why? Because they didn't want to be on the same side as Donald Trump. It was a political decision. It had nothing to do with the best interest of kids. Matter of fact, the kids are damaged. We have a real serious problem with kids in many states that are now 2 years behind in their academic preparation, and that is going to have long-term implications. Or what about masks? There was absolutely zero evidence that kids were at any risk of COVID, and certainly no evidence that a cloth mask on a kid 2 years and up would make any difference at all. Yet, the American Academy of Pediatricians pushed it anyway. And as a result, people were required to wear them on airplanes. And as a result, we had story after story after story for almost 2 years where people were getting kicked off planes because they had an autistic kid that was a little over 2 years of age that wouldn't keep a mask on. Frankly, who cared? This is just absolutely barbaric behavior on the part of the airlines, on the part of the stewardesses, and particularly on the part of the doctors who should have known better. They should have said, frankly, there's no evidence, we're not going to recommend it, and if they hadn't have, it wouldn't have happened. But they did it anyway. Shame on them. They even go as far as trying to interview kids to ask, do you have any guns at home? And how are they stored? Frankly, that's none of their business. That's not a medical decision. If you want to have a discussion over how firearms should be stored in the home, that is a political decision, not a medical one. It's none of their business, yet they're injecting themselves in it anyway. And that's what's happening with our psychopathic health system. And I keep warning you, if you want to get healthy, do not go to doctors. Doctors are the worst place to do it, I think. Frankly, they are fantastic when you've got acute problems. You got a royally high fever, you got a broken bone, stuff like that. That's when you need medical care. You need acute medical care then. But if you want to get healthy, you're on your own. Thankfully, we can all be alone in this together. We can learn how to eat properly, to get ourselves pulled out of the medical system, and that includes kids, because frankly, the pediatricians have just been ridiculously politicized because of these national organizations. And it's time to get the heck out. Quit funding it. I mean, why should you pay your good money to go see a pediatrician to be lectured about football when it's not a medical decision? Why should you go to a pediatrician to be lectured about wearing a mask when there's just no medical information? Why should you go to a pediatrician and pay good money to be lectured about how you own guns? It's none of their business, it's not medical, and it's not making you healthier. But they're ignoring the stuff that would make them healthier, including fatty liver disease, type 2 diabetes, obesity epidemics, but they won't say anything about that. They're just going to be body positivity because that's the politically correct thing at the moment. And that's the ridiculous part about this whole system. So quit trying to rely on doctors to get you healthy. You got to figure that on your own. This is Kirk, the Bariatric Carnivore. If you like this message, please hit the like and subscribe button. If you want to hear more messages like this, I try to put out a new one every Tuesday and Thursday. And I will talk to you soon.